Hello, and welcome to this fourth season of the Circ Pod, the bilingual scientific podcast presented by the Canadian Consortium for Research in Epigenetics, Environment and Health, hosted by the Student Committee. This season stands out from previous ones, as it is a special edition dedicated to scientists who have built their careers outside of academia. Through these episodes, we will explore the career journeys, research, interests, and much more.
Hi everybody, welcome to today's podcast. I'm Laura Godfrey, your host today. I'm currently a postdoc at Dana-Farber Cancer Institute. And my co-host today is Dr. Paola Marignani, who is a full professor in biochemistry and molecular biology at Dalhousie University. And it's with great pleasure today that we welcome Dr. Rafaela Andrade, who is the CEO and co-founder of Myomar Molecular. And today she will talk to us about her career path in molecular biology, which started in academia and is now currently in industry. So welcome, Rafaela. As a start, would you like to briefly introduce yourself and maybe share with us about your current role and a little bit about your journey into science?
Hi, Laura. Good morning. Thank you for the opportunity to have me today. Yes, I'm very excited to talk about my path today. I think I would say everything started when I was in my PhD under Dr. Paola Marignani supervision at Dalhousie University. And I always had an interest in translating my research from science into commercialization. And at the time, I had a lot of opportunity to go into the community, speak about the science to women that was going through cancer. And it was very interesting to see the perspective of the community and their interest in science to help improve what they were going through. So when I finished my PhD, then I started doing my postdoc at a lab that was studying muscle. So using what I had learned from cancer metabolism, I applied that into muscle metabolism, and then I started really thinking about how can I translate my science into a commercial product. And towards the end of my postdoc, then we were studying mice that had muscle atrophy, and were able to discover some biomarkers that changed when the mice had muscle atrophy and was different for when they did not have muscle atrophy. So that information sparkled an idea in my mind of, well, we could maybe create a way to detect those biomarkers and predict muscle atrophy in early stages. And that was where the idea of the company started. So then we continue moving the research towards that idea to see if would have success. And then when we discovered that this could be an interesting product, then I left my postdoc and started working full time at Myomar, and we incorporated a company and started working on clinical studies to validate our ideas into clinical settings. So I think in a nutshell, this is where everything started. And then I can talk more about the evolution of the product later.
Sure, sounds good. And maybe a follow-up question for that is, you started off in academia. What really, interested you to start pursuing a career in the biotechnology industry rather than, remaining in the academic space?
Well, in the academic space, a lot of the research, it is basic science. A lot of professors will do basic science, and they will have very interesting discovery in the basic science area. But not all professors will think about the science as innovative to translate into commercialization. It's very rare to find actually professors that do that. Paola being one of them, but not many professors go into that route. And I was doing my postdoc in a lab that was pretty much focused on basic science, and they didn't want to translate into commercialization. And I had this entrepreneurial spirit, and that was also coming from a family full of entrepreneurs. And I always want to do something that could be used for people right now, not in 50 years from now. So that's why I kind of bridged the gap from going from academia into commercialization, because I really felt that I would be happier. I would be happier translating my science right away and see a product in the hands of people.
So I'd like to add to that. While Rafaela was in my lab working on her PhD, there was a lot of conversation about translating what we were finding in the cancer metabolism space to some sort of clinical setting or translational research. And at the time, I was working on my executive MBA at Ivy. And so the conversation, we're bridging the gap. There was the basic science, what we needed to do to get the animal models through, and then what that could mean potentially in the future. So I think the environment, as Rafaela pointed out, is a little different in my lab, where we're always thinking about how can we move this forward? How can we get this out into the world? And I think it was a combination of her family's entrepreneurial and business acumen, Rafaela's want to not remain in academia and to move out. And part of my mentorship strategy is to listen to what a student wants and facilitate that. And I think it was like the perfect storm of two people meeting like-minded, me being more an older person and Rafaela being a fairly younger scientist. It kind of came together at the right time. And I think Rafaela just really ran with it and has done amazing things. And she's going to tell us about her company shortly. So I think it's the environment that has to foster it as well.
Following on from that, you've been in academia, you've been in industry now, and just wondering, who are your role models along your way that you've, as you've moved throughout your career in the different spaces? Maybe you could just talk to us about some of your mentors as you've gone along, including Paola, obviously.
Yes. Yeah, so Paola was one of the first mentors that I really have that showed me the way that we could um, be very highly educated, but use the education to do other things, not just teaching at university or do research at university. And I really was interested in doing something more than academia. I wasn't very interested in teaching. And she showed me that there was a possibility, right, to get out of academia and do something different. And I also, when I started working on my company idea, I was very surprised how well received I was by the business community. Um, because as a scientist, sometimes scientists are very difficult people to talk to, and they are very secretive about their own research, so they don't want to like share as much. It's really sometimes really hard to talk to them about ideas or innovation and all that. But when I actually start talking to business people, and these are CEOs of large corporations, billionaires that build their companies from ground zero to huge enterprises. They were really willing to talk to this student that was very naive and very young into all this. But I was really surprised that they opened the doors and talked to me and actually explained a lot of the challenges they went through growing companies and doing business. And that pushed me to see how this business world was so much more collaborative and interactive than academia was. And I was really supported by this group of early business people that not just gave me training, but they also invested in my idea in the company. And that allowed me to actually leave the academia and start working at Myomar full time. And those business mentors, they actually invested in Myomar when it was only an idea. I didn't have any product. I just had a vision and an idea. And really, they believe in me, and they put their money and time on training me and showing me the way how to build this. And now we are 4 years into this with a lot of success that was built because someone really believed in the beginning.
And so, now maybe we're talking about the transition into your company now. So you're the CEO and co-founder. of Myomar. Do you want to give us a little bit of a overview of what your company does, and what your typical day as a CEO looks like?
Yeah, so when I started Myomar, I actually interviewed over 100 people in a program called Lab to Market at Dalhousie University. And that experience helped me to understand if there was a problem that my solution could solve. So the interviews really opened my mind to the value proposition that I was going to develop for this product that I didn't have yet. But it helped me to see how I could use some of the ideas of a test that would predict muscle atrophy in early stages and how people would use that product to improve what they were offering at the time. So then what I decided that was important was that they needed accessible tool to measure early stage muscle atrophy. They needed some quantification and quality information about muscle health or overall muscle strength and quality of muscle that they also didn't have access to it. And they need a gradient scale to show how close people were to sarcopenia instead of just a threshold. Because right now, the golden standard, it is a threshold where above that threshold, you don't have sarcopenia. Below that threshold, you have sarcopenia. So really, medical doctors, physiotherapists, nutritionists were trying to understand this at a more granular level. Are you getting close to have sarcopenia, or you are completely far away from having sarcopenia? And today, the gold standard doesn't give you that information. And also another gap in this was that people were not able to give information about the quality of muscle. Because today we can relate it into muscle mass. So if you look at in the mirror and see, well, my muscle mass, it is good, it's growing, I have a lot of muscle. But a lot of muscle in terms of mass does not always correlates with quality of muscle. And that information is also not available today. So when we selected the biomarkers that we selected, we really thought about those as a panel that could translate not just overall muscle mass, but also muscle function and quality. So we developed this first urine-based test that detects 5 biomarkers in urine, and those 5 biomarkers are related to amino acids that making protein for protein synthesis and muscle growth. They are related to mitochondrial energy function to improve ATP generation for muscle function. And they are related to muscle degradation levels that impact how muscle grows and how muscle degenerates. So we really look into a deeper level into muscle metabolism that translates into muscle health. And we show through our clinical studies that our 5 biomarkers using a simple urine test correlates with both a DEXA scan in terms of predicting overall muscle mass, but also correlates with physical assessment for muscle function. So our test, it is very interesting because it englobes those two areas of quality and quantity of muscle. So for the first time, we have this tool that's now available across Canada that allows medical doctors, individuals to understand their overall muscle health with a better understanding of muscle metabolism.
And, maybe as we've started talking about the science behind it, we could jump into that a little bit more now. And you said, that this really was from the lab, the discoveries that you were making during your academic career. Can you talk to us a bit more about the biomarkers or the molecules that you're detecting in your test, and how does the technology identify them?
Yeah, so like I said, the molecules were a combination of different metabolites that we see impact muscle. So when we select those biomarkers or metabolites, we had a big study with using tissue bank, and we compare individuals that were sedentary to individuals that were highly active. And we saw there was difference between those specific biomarkers. We had about 40 of them that was very interesting to search. But we narrowed down to 5 because those 5 were more related to the different aspects of how muscle growth. And 2 of them are amino acids that builds proteins for muscle fibers growth. They some of them, 2 of them, these 2 of them that use for protein synthesis, they are known in the muscle-related research that shows increase in performance and increase in muscle quality by different publications. And we put them in our panel because we knew the importance of those 2 biomarkers for muscle performance. Then I really want to add something that was related to the energy pathway of mitochondria, and we detect many biomarkers in the energy pathways for mitochondria. Some of them was difficult to detect in urine, so we decided not to use them. And we narrowed down for 2 of them. One, it is a fatty acid transporter, that it is also very well known in the athlete industry because it gives athletes enough energy for performing. The other one, it is linked to the TCA cycle, the Krebs cycle. You remember your biology courses, the Krebs cycle energy production, and it is one of the intermediates of the Krebs cycle. It is really important for ATP production, and we chose that specific biomarker because it was easy to detect in urine and was very important for ATP generation. Interesting enough, that specific biomarkers is also influenced by hormone changes, especially when women are going through menopause and hormone drops, and the influences directly how mitochondria produces ATP, and that biomarker is influenced by the decrease in the receptors of estrogen receptors. So we see a very interesting link as well between hormone replacement therapy and those biomarkers. And then finally, we chose a biomarker that was linked to degradation because we want to see, for example, levels of tissue degradation and tissue degeneration. And we chose a biomarker that it is a sensor for reactive oxygen species. So when there is high levels of reactive oxygen species build up by breaking down of purines and DNA synthesis, then we can see increase of the specific metabolite. And that metabolite now is today being used for understanding recovery for athletes in our athlete population. We can see acute change of the biomarkers if they are training super hard and there is more muscle degradation than building and they're not recovering as fast, then we see a spike in oxygen species for those athletes. And similarly in women in menopause as well, if they are not building muscle at the same pace they are breaking down muscle, we also see an increase in that reactive oxygen species metabolite. So this panel that we build, we now believe that they can give an overview of muscle health in a very personalized way and specific for each one of us. So each one of us, we have different aspects of how our muscle is growing and how our metabolism is doing. But looking intrinsic at the levels of those biomarkers, we can pinpoint if you need more attention to your nutrition, if you need more time for recovery, or if you need more of the energy biomarkers, therefore increasing specific types of nutrients to help with your energy balance. So when we decided those biomarkers, then we had another problem in our hands. How we're going to make this easy for people to identify the biomarkers in urine. So those biomarkers are not, you cannot walk into a lab, in a central lab and say, I want to take a muscle test and I want to measure this biomarker. This doesn't exist. So we really decided to start building a assay that would identify those biomarkers in urine with an easy approach. Had to be something simple. We couldn't be using mass spectrometry, for example, because it is not a piece of equipment that's easy. And we decided to use ELISA-based assays and colorimetric changes of the levels of the biomarkers to indicate and quantify those in urine. So we then select a specific assays, more enzymatic based. And right now we are developing our own set of assays that are going to be easier and more, it will be a faster type of assay too. It continues to be ELISA based, but much more simple. We're not going to use enzymes anymore. We're going to change it to aptamers, which it is a technology that we are really deep into studying right now. And then this is our lab developed test, which has Health Canada Class 1 medical device license, and we're selling across Canada. We have some clinics in the US as well, but mainly our customers, it is in Canada until we start going to the US next year. And besides that, we're also developing a rapid test. The rapid test is very revolutionary because it's not going to use antibodies. It's going to be a rapid test that uses nanoparticles, and you can detect and semi-quantify the biomarkers at home with immediate reading. So people will be able to take the test more often and see how the muscle health is doing. This is very interesting for GLP-1, Ozempic, Wegovy users because they will lose fat tissue when they start GLP-1, but they can lose muscle as well. So it's really important for people on GLP-1 to monitor the muscle health as they continue in the therapy to prevent developing sarcopenia or musculoskeletal diseases. Because these will be very serious and difficult to treat, especially if you are young. So we believe that the GLP-1 users will be a huge customers for us once we have the rapid test in market.
And do you think that's something that those people would go to the doctors and have that test done, or would it be, a home test eventually that people could use themselves?
Yeah, we want people to use themselves. So in the beginning, the medical doctors will recommend the test, and perhaps they will have the test in the clinics. But because the rapid test is so easy to be distributed, we can eventually send to people's home.
And so it's really a combination of those different biomarkers that you use together, which is why it can be, so personalized, because I guess there's different ranges of normal depending on the individual with those different biomarker combinations. With that, is there any, you've just mentioned the GLP-1 patients. Are there any other particular patient populations or conditions where, this test might be especially beneficial? Or patients with chronic conditions, or maybe some that are undergoing routine screenings?
Yeah, so we do have a huge market in the menopause space as well. As women going through menopause, they want to understand some of those symptoms and even be able to see if the hormone replacement therapy it is a proper way of treating their symptoms or not. So we can predict and we can see muscle health in early stages that reflects how they are feeling as well, which is very exciting. So we see women that they are not in menopause yet, they don't have a huge hormone drop, but they're already feeling a huge fatigue, they can't sleep very well. They are already feeling the perimenopause symptoms, and when they test with us, we can see those symptoms being reflected into muscle health right away. So usually they come to us with a drop in hormone in the fatty acids metabolic pathway. They come with us with low levels of amino acids for making proteins and high levels of reactive oxygen species. I'm actually going to speak at the Menopause Society in 2 weeks about this first set of pilot studies that we conduct with the women in menopause versus women that are not in menopause. So menopause is a huge influence to muscle health. GLP-1 is another market that we're looking into, and we also have longevity and aging as another market. A lot of people today take a year test to understand their overall health, and our muscle test has been added to the panel of testings for annual assessment. So we work with clinics in Canada. Signature Health is one of the biggest clinic in the Atlantic Canada, where they do yearly assessment to individuals that come into the clinic. So they add our test in the panel for understanding muscle health. And muscle is really your longevity organ and speaks to all your other systems. So it's really important to maintain good muscle quality as you age.
When you get the result back from your test, what do people generally do with that? Do you offer like a recommendation of how they can improve their muscle health?
Yeah, so usually the report is ready within 7 days, and we really give a overview of your muscle metabolism, and we tell you which one of the biomarkers are in optimal zone and which ones are suboptimal or even high. So if you see suboptimum conditions, then we can give you a list of specific nutrients that you should be adding on a daily basis to increase that biomarker level, and will reflect quite a bit in your overall muscle metabolism. And if the biomarkers are high as well, sometimes it's management of stress, it is management of sleep, and having better antioxidant in your diet as well. So we give people specific guidance that are very personalized and specific to their own muscle metabolism.
Looking into the future a little bit for Myomar, how do you see, do you envision, the next 10 years of the company, and how do you see, the innovations improving patient outcomes, and what kind of impact could that have on global healthcare in the future?
Yeah, so we are really looking to understand more and more about muscle metabolism as we grow the company, and having different types of clients to where we can understand how muscle metabolism is responding to different diseases like cardiovascular diseases or muscular dystrophies, all that. It is important for muscle. So we really think that the evolution of our product will be a correlation with the different biomarkers, with behaviors as well. So right now we are building this foundational AI approach where we want to be able to predict specific behaviors depend on the levels of the biomarkers. And for example, we can tell people how what's the frequency they should be going to the gym, for example, or how many glasses of alcohol they can eat before affects their muscle health, or which type of supplementation they should be taking. So today there is especially in the supplement industry, talking about supplement is so big, and everybody has all this information, don't know what to do. Should I take all these supplements every day? And sometimes they are taking more supplements they actually should be taking. So really having a way of monitor that and see what it is effective for you, it is really key to tune your muscle metabolism to the best you can. So we are working towards giving people specific information on supplementation and exactly what they should be taking in terms of supplements. So all these pieces are evolution of the product. So again, the AI behavior information, information on supplementation, and be able to correlate different conditions with muscle metabolism as well.
The whole goal of the podcast is to sort of help the trainees understand that there can be a lot more done with a PhD, not just the academic route. So I think, I like to stress that Rafaela's journey and her path to commercialization and entrepreneurship is a perfect example of what you can do with your PhD training and your postdoc training, because often students are working away on their thesis and they're not able to see in front of them what their research can be used for. And Rafaela was able to distill her PhD work and her postdoc work to create something completely new in an unmet space where there is an absolute need for. And so I think it's really important for trainees, both at the graduate level and at the postdoc level, to really try and think outside the box, because her path exemplifies what can be done with a PhD education and postdoctoral training, and having a vision, looking outward to be able to apply everything that they've learned. And now they're creating space and they're creating job opportunity. They're entering markets that perhaps Rafaela and her company hadn't envisioned 3 years ago or 4 years ago when they started the journey, when she started the journey. And so I think it's a really good example for the trainees and the fellows to see that there's just so much more to their education than that final thesis. And I think this needs to be, trainees need to hear this.
Yeah, and I think, you can just get so focused in on all of the details throughout your training that
Mhm.
it's really hard actually
It's very
to
hard,
take that
and
step back and really
it's very, very
look
hard,
around.
right? And often, you know, Rafaela's journey I'm very familiar with, and like I said, it's a perfect example. Sorry, Rafaela, I'm cutting in because I think it's really important. You know, we've had this conversation so many times, you and I,
Yeah.
when you were in my lab. So I think the problem still persists to this day, where students just question, why am I working 4 years, 5 years nonstop? What is it going to get me?
Yeah.
This is what it could get you, right? And I've often, you've heard me say this also, Laura, an academic career is the alternative career path. It's not the main one, it's the minor one. Everything else is the possibility. And academia is, at least in modern times, is the alternative career path.
Yeah, but I think when you're in it, that is not
When you're in it,
that
it's,
is not clear at
intense.
all. Yeah.
So
It's
a question for
Uh,
Rafaela, is there anything, now that you've done your entire education journey and your entrepreneurial journey, and you've built something new and you've created this industry, is there any advice that you can give to a person who's in their PhD or their master's program or nearing the end of their postdoctoral training that could help them for their next stage? Is there any sort of advice that you would like to share?
Yeah, there is a lot of advice, but I think like going back to your point about the academia being this secondary route that you can take, I think also not everybody will be able to create a new technology, but for example, right now in my company, I have many PhDs that came to work with us in the very beginning. So also be part of a startup, not, maybe not as a founder, but as someone that can build and create things in the very beginning of the startup is also very exciting. And the growth of our employees in coming in, it can be it's so much quicker than if you actually go into academia. They have been promoted on a yearly basis. Who is promoted in a yearly basis right now? Not many. Right? Exactly. But that's what a startup can provide to you. They also have shares in the company, so everybody grows together, right? So if we sell the company in the next few years, they are going to be really benefited from that sale, and it's really fulfilling for them to see that everything they are creating, the ideas they are bringing to the table, they talk to me today, the idea is implemented tomorrow, and it's in the hands of the consumer by the end of the week. This is so exciting, right? So I think I also think about that too. Look around the university. Who is starting new companies? How you can use your skills to join that company early on. So that's also one of the advice that I give to students that are looking into other paths, not just academia, to look around and see what others are building. Another thing too about this is that throughout your career, especially in the academic career, a lot of people will not value your work as much, and you're gonna get a lot of people thinking they know much better than you, but really believe in what you are doing, and you're not gonna have all the answers right away. But if you really give you time for your ideas to evolve and surround ourselves by people that believe you, then things is going to start happening. Like throughout my postdoc, many people said, "Are you crazy to continue working with this?" Wasn't very supportive. Blocked some of my publications even, right? So then I couldn't move out from academia. You're going to have those trolls and haters along the way, but it shouldn't be, I'll say, do not let them put you down, and just continue working hard on what you believe it makes you happy, and everything, the path clears over time. So I would say that it's not easy to change your career completely. It takes courage, but it is worth it if you really are willing to put the time onto it. Like you're going to have people supporting you, and you're going to have a lot of people that are not supporting you. And I think women also, it, I, I don't want to say like women has less opportunity than men, but I would say it is challenging, especially if you want to have a family and you want to do all this, and you also want to be a mother. I'm saying that because I had my first child during my PhD, and I had a lot of support to actually defend my PhD and finish that PhD. But I went into my postdoc willing to have more children, and if I had that decision in my hands at that point, I pretty much was like I'm going to be successful into my postdoc, or I'm gonna be a good mother. So it's pretty much the decision came to my hands. I have to do one or the other. I can't do both. And I decided that wasn't a choice. I actually could be a good mother and actually succeed in my career as well. And I refused to actually be one or the other. I actually thought that I could be both. Uh, and I had another two children during my postdoc, and that was during COVID as well, so very challenging, all that. Because of that, being a mother, trying to do PhD, thinking about switching careers was really challenging times. And I had a lot of challenges as well, getting people away from the mentality. Not me, actually, people that were behind me that didn't believe I could be both. And I was 100% backed by my family saying you can actually do both.
Oh, I backed you. Backed
Yeah,
you.
and Paola too, exactly. And Paola too, yeah. So I ended up doing it, but it's just to say that it's not going to be easy, and you can actually do both if you really believe in yourself.
We're getting better at it as a society, but when she was going through, I think it was this sort of transition, 2014, 2015, it was a transition between where we're starting to understand the need for EDI and equity and diversity and inclusion and making space for women in research. It's getting better, but there are still challenges.
Yeah.
And this goes back to the conversation where you need to make sure that the people around you are supporting your vision. And that could be research, and that could be a family, and that could be whatever. My job isn't to say no to you. My job is, if it's fine, if I have the research funds and it doesn't cause an explosion or major damage to the lab, then I'm like, let's go for it. Let's do it. And usually what's rate limiting is the finances to actually do the experiments. That's usually the most limiting step. If it's an idea, go for it. If you need family time, take the family time. So, Rafaela, you spent about a year in the CDL program where you met a lot of VCs, angel investors, and you learned a lot about how to raise money for your company. Can you tell us some of the challenges that you may have had while trying to raise money for your company, particularly in the early days where you were at the prototype stage, you still didn't have everything quite formalized. How did you go about raising the funds?
Yeah, I think, like I said earlier, money is really the limiting steps here. So we have to find the money to be able to grow the company, especially if you are in health science, because it's going to be years of development before you actually have revenue to support the entire company. So for me, it was really hard in the beginning to change my mentality from being a scientist and just work with facts to be a business, have a business mind. So every time I pitch, everybody was like, don't be a scientific, actually sell the value of the product, even though if you don't have the product yet. Because that's how the business works, right? You sell the vision. So then I started changing a little bit of my mentality and really thought about it is okay to sell the vision instead of something concrete that we have right now. Because if you're gonna sell the concrete product, we're never gonna make the money enough to build that actually concrete product, right? So I think the first step is actually to change your mind from being too scientific and play a little bit in the business side. Of course, having realistic goals, but also know that you're not going to have a perfect product day one. Um, and then the second thing was to surround yourself with people that really see the value of what you are building, because you're going to speak to hundreds of people that some of them will not give any value to what you're building, but for the ones that really give value, they will continue conversations in terms of investment and moving forward. The issue is to find the right person that values your product, right? So that's why entrepreneurs, founders have to talk to hundreds of VCs or angels to be able to find the proper person that will invest because they really connect with your product. So finding those champions that understand your product is really key. And one of the main things about finding those people is actually see who has the pain, right? Who has the pain, like who your product can solve the pain for. So I have some early investors that invested in Myomar because they were medical doctors and they understood there was a market for this product. And they invested very early in the beginning. So finding those medical doctors was key. They also were good key opinion leaders to have on our website or um, give testimonials and things like that. So that's the other piece. And really going out there to conferences to speak to more people outside your region is also really important, because sometimes people from your own region will not give the actual value to your product because they are used to you, right? They see you from the very beginning, and sometimes they don't understand how this can grow bigger and bigger. But if you go to other regions and start talking to other people to that outside your growth paths, they see you where you are now, and they actually can give you more value for what you're developing. So I think it's also important of moving a little bit around to meet other people, and going to conferences make a big difference. Yeah, I think those are the three main things that I would say about funding raising. And perfect your pitch. I never was good at presentation. I improved quite a bit, Paula, I can tell you that. Slides was my worst nightmare. I can make slides. And I don't make slides. I know I have a gap on that. And then I have people in my team that make the slides for me because I can't put in my slides together, right? So really, you have to find people that can do things better than you, and trust on them. They will help you achieve what you need. So um, yeah, so I think like finding the right population to talk to you, change a little bit the mindset from scientific to business, and go out there, like talk about your science, talk about your project to other people outside your main area, and a lot of doors open.
So it's really important. You highlighted that you have to speak to a lot. So I think for the trainees and entrepreneurs to be not to discourage if you get rejected 10 times, because I know that you've gone to at least more than 100 pitches to try and get one. And if you're used to doing research, 9 out of 10 experiments fail. So it's similar to that, but I think you really you stressed that it's important not to get discouraged if the message falls on ears that are just not ready for the message, or they're not interested, or they're not aligned with your vision. So I think it's really important that you've highlighted that for the audience, not to get discouraged and just to keep believing in your product and what you're creating, and just keep going out there, conferences, try and get in front of pitch opportunities, and to really work on your delivery of what it is that you do. So practicing all the time, trying to create content that is easy to understand and easy for the viewer to understand what it is you're trying to create.
Yeah,
And so I know you've gone through this journey, Rafaela, and you've done amazing, actually. You've from zero to above 100. So I'm really proud of you.
thank you. And I think that piece about delivery that you just mentioned is actually really key, because the product, it was the same what we had like 4 years ago, but now I can talk about the product much better. That
Mhm.
yeah, people can understand easier than it was 4 years ago when I started talking about this with Paola. She can probably say too, like it makes much more sense right now that I evolved this, not just for my fundraising efforts, but for myself as well. I can talk much better about my product now than I was able 4 years ago, and that's because of practicing and not being discouraged with the many no's that I receive on a daily basis. Right, every single day I'm pitching to people, and maybe I'll get a yes and next meeting, but the practice of talking about your product over and over helps you to evolve the story, right? To communicate better.
It's interesting you should say that, because you did talk about 4 or 5 years ago the same 5 or 6 metabolites that you had pieced together as going to be part of your device, your product. It's the delivery. And, this comes with practice and knowing your audience, and of course, learning from your audience, because I think you were listening to what everyone was saying. Obviously, you were listening, but you weren't just listening, you were actively taking it in and registering. Maybe this is how I should be presenting it, or maybe this is how I should be presenting it. And depending on the audience, you adjusted. And I just think that's part of the evolution of an entrepreneur, of someone who's speaking very complex stuff to the general public. Um, and so, yes, it has improved, but I think that's part of the journey. And the next challenge you have, you'll have to, even with myself, and I know when I'm taking on a new space in research, it just takes me a little longer to learn the words of the research. And I also think that because when you were in my lab, we did go out into the community quite a bit to talk to the community what it is that we were doing in cancer. That also gave you opportunity, and even me opportunity, to work with the language of how to talk to the public in different levels. There were the business people, they were the patient partners, people who were just diagnosed with cancer. And so trying to balance how you deliver and to the audience is a skill. It's not something you're born with. It's a skill that you can acquire. And I think you've done that brilliantly, because I've heard you pitch from from your thesis all the way through, right?
Yes.
So through your thesis, your defense, your all the talks, and of course through CDL, and now listening to you speak, there's obviously you've created this. You're the expert in the room, and your team is contributing to that expertise in there. I think it's really great how you've been able to move it along, right? Your communication.
Yeah. Yeah, I almost think I wasn't ready, And every single time that I get a no, I always think I was not ready because I was not able to communicate this well enough for people to get it and see the value. So I don't blame other people. I actually think that I needed to improve it. That's why I got no's, and maybe I'm talking to people that are not the ideal customer too.
We've been mentioning the CDL, the Creative Destructive Lab, quite a bit. But, maybe for the trainees who are listening and are interested in this, can you both provide a summary of this program and just so we can understand what that's about a little bit more detailed?
Creative Destruction Labs was first developed at the Rothman School of Management. And it's a space where it brings venture capitalists, investors, biotech companies, tech companies in one space, and it allows or brings in startup companies to pitch their ideas, their innovations, their discoveries with the hope of creating matches for potential investments. But part of all of this program is to give the tech company an opportunity to learn and grow and meet certain milestones every few months and then pitch again in front of the creative destruction lab space. And so it's about a year-long program, and there's a competition to be invited to the program. And your very first introduction to all of this very large room of investors and mentors, and I'm a mentor for CDL Atlantic and CDL Cancer, and tech companies can introduce themselves, pitch their innovation, and if the room feels that they're on the right path, they'll be invited to the next round. And there are 4 rounds of this competition. And it's really an important innovation in Canada, and CDL now has gone global. It's in various parts of the world, and we're very lucky that Dalhousie is one of the centers for CDL because it gives young entrepreneurs almost immediate access to this space.
Yeah, so this CDL for me was actually one of the major doors that opened when I started CDL. I was in the very beginning of putting the value proposition together for the company. So I applied through Dalhousie University and the Lab to Market program, and it was really good because when I was accepted into the program, we will go on into pitching to all these business people that are very successful in their own fields of work. And every single time we pitch, we get a couple mentors in the team that work with us for the next 3 months. And then they go through sessions to improve our business model or our value proposition or even our pitch. Um, and then we work with them for almost a year, and every single pitch it is a competition. So if you pass that pitch and mentors choose you, then you go to the next round. And at the very end of the CDL program, some of the mentors they have ability to invest it in the company, and you also open up a lot of network to know other people that are investors, but also business strategists too. So when I finished the CDL program, I actually got investment from my mentors, and I was able to communicate as well with others for strategic business development, which helped quite a bit the evolution of the company.
And were you working as a postdoc the whole time that you were at CDL, or you stopped postdoc to go to that?
No, I was working full time. Yeah.
Okay.
At the time, I also had 3 children, so I didn't have the ability to drop out of my postdoc. I had to
Yeah.
continue working. So I continued working that program. So after I finished CDL, that we raised some money. Then 6 months after, I left my postdoc and started full time at the company. So I've been full time since January 2022.
Wrapping up, what advice do you have for young scientists and entrepreneurs looking to enter the biotech space or launch their own startup?
Yeah, I would say think outside the box. Couple of things that I mentioned about in the talk was to really believe in yourself. Don't be discouraged by people that do not believe in you. Um, think about this as one of the hardest jobs you're gonna have, but also it is really rewarding to do what you love. A lot of times I will do not feel that I'm working because I really love what I'm doing. Although my days are really long, I start at 6 a.m. and I do some things with the kids, activities with them, and then I get back to answer emails, and my day finishes at 9 p.m. I work quite a lot, especially at this stage that we don't have a lot of people in the company. Know that you're going to have to wear many hats. So you're going to have to do pretty much everything to build your company. Also, surround yourself for a team that is loyal and it is talented, that can help move your product forward and really believe in the product.
Okay, great. Well, thank you so much
Thank
for
you.
joining us. It's been a pleasure talking to you and getting your insights. Really interesting. Thank you.
Thank you.
Thank you, Rafaela.
Thank you for listening to Season 4 of the Circ Pod. If you enjoyed this podcast episode, you can check out our website for future episodes at thisisepigenetics.ca.